Welcome to 10-Minute Health Tech, the AI-powered podcast where we dive into healthcare technologies and companies so you don't have to. I'm Anthony.
And I'm Julia.
Today we're diving deep into Vori Health.
Yeah.
They're trying to change how we deal with something I think a lot of us are familiar with, muscle and joint pain.
Muscle and joint pain, that's right. And their big claim is that they can do it more conveniently and effectively than traditional methods.
Okay, so paint the picture for us.
Yeah.
What is Vori Health doing differently?
Well, they call it a whole person approach to muscle and joint pain. So imagine this. You wake up with like that nagging back pain.
All right.
And instead of waiting weeks for an appointment, you just open an app on your phone.
Wow, so it's all virtual, like telehealth, but specifically for muscle and joint issues.
Exactly. And think about what that means. Quicker access to specialists, less time off work, and potentially fewer unnecessary procedures. They're really trying to cut out a lot of the frustration that comes with the traditional healthcare system.
Yeah, that sounds pretty appealing, especially for people with busy schedules. But can virtual care really handle everything? What about the hands-on aspects of physical therapy?
That's where it gets interesting. Vori combines medical doctors and physical therapists in a single virtual visit.
Oh, wow.
So you're getting a comprehensive evaluation right from the start, which could lead to a faster and more accurate diagnosis.
That's a huge difference from, the typical experience of bouncing between different specialists.
Right.
So walk us through this, how does a virtual visit with Vori actually work?
First, they really focus on understanding the root cause of your pain, not just masking the symptoms. So they might ask about your sleep, your stress levels, your diet, things you wouldn't normally associate with muscle and joint pain.
So they're looking beyond just the physical symptoms. It's like a more holistic view of your health.
Precisely. And after that initial evaluation, they create a personalized digital care plan for you. And this includes exercises tailored to your specific needs, but it also addresses things like sleep hygiene and nutrition.
All within this app.
All within this app, exactly.
So it's not just about physical therapy. It's a more comprehensive approach to managing pain. That's pretty innovative. But does it actually work? What are people saying about Vori?
Well, we have some patient testimonials to look at. One patient, Jasmine, raved about the convenience of being able to fit appointments into her busy schedule, even during work breaks.
That makes sense. No more taking time off work or fighting traffic to get to appointments.
Exactly. And another patient, Robert, talked about significant pain reduction. He went from an 8 or 9 on the pain scale down to 0.
Wow. That's a pretty dramatic improvement.
Yeah.
Are there any other patterns in what these patients are saying?
Yes, many of them talked about feeling empowered and like they were finally getting a piece of themselves back. It seems like that sense of control and active participation in their own care is a big part of the appeal.
That makes sense. It's one thing to get pain relief, but it's another to feel like you're equipped to manage your condition long term.
Absolutely. And that ties back into Vori's emphasis on a holistic approach. It's not just about treating the immediate pain, it's about giving you the tools and knowledge to prevent future issues.
I'm curious about the accessibility of this type of care. Is it only available to people with certain insurance plans, or can anyone access Vori?
That's an important consideration, and the good news is that Vori accepts all major insurance, including Medicare and Medicaid. They also offer a self-pay option, so they're trying to make this approach accessible to a wide range of people.
That's great to hear. It seems like they're really trying to make a difference in how people approach muscle and joint pain.
They are, and it's definitely a model worth paying attention to as virtual care continues to evolve.
So we've talked about the convenience, the whole person approach, and the focus on getting to the root cause of pain. But what about the limitations of virtual care? Is there anything Vori can't do that traditional in-person care can?
That's a great question, and one we need to consider carefully. For example, are there certain types of physical therapy techniques that are difficult or impossible to replicate virtually?
Right, and how do we measure the long-term effectiveness of this approach? I mean, the testimonials are compelling, but we need more data, right?
Exactly. Does the virtual format limit certain types of treatments? How does patient engagement and adherence compare to in-person care? These are all questions that need to be explored as this type of virtual first care becomes more common.
It's definitely a shift in the healthcare landscape, and it'll be interesting to see how Vori Health and companies like it evolve.
Absolutely. There's a lot of potential here to improve the patient experience and potentially achieve better outcomes for people struggling with muscle and joint pain.
Definitely something to keep an eye on.
Yeah.
So Vori Health is clearly trying to shake things up. But let's zoom out a bit. Where does Vori fit into the bigger picture of musculoskeletal care? What trends are we seeing in this space?
Well, one of the biggest trends is this shift towards patient empowerment and personalized care. People are taking a more active role in managing their own health, and they're demanding solutions that fit their individual needs and lifestyles.
And technology is playing a huge role in this shift.
Right.
We're seeing more and more digital health tools and platforms that are giving patients greater access to information and resources.
Exactly. And Vori is a prime example of this trend. They're using technology to make expert care more convenient, personalized, and accessible. But it's important to remember that Vori is just one piece of the puzzle.
Right. There are other companies and approaches out there that are also pushing the boundaries of musculoskeletal care, and it's important to be informed about all the options available.
Absolutely. And that's why we're here to help you navigate this complex landscape and make informed decisions about your health.
So for those of you listening who are dealing with muscle and joint pain, I think we can all agree that Vori Health is at least worth considering. It's a new approach with some intriguing possibilities.
It is. But as with any healthcare decision, it's crucial to do your research, talk to your doctor, and consider what's best for your individual situation.
Great advice. Now, before we wrap up, I want to touch on something we haven't really discussed yet,
Okay.
the potential impact of Vori's model on healthcare costs.
That's a critical point. Proponents of virtual care often argue that it can reduce costs by streamlining care, minimizing unnecessary procedures, and improving patient adherence to treatment plans.
And that makes sense intuitively. But is there any evidence to support these claims? Has there been any research on the cost-effectiveness of Vori's model specifically?
That's a key question that needs further investigation. While there's growing evidence that virtual care can be cost-effective in certain contexts, we need more data specific to Vori's approach and how it compares to traditional models in the long run.
It's something to watch closely, especially as virtual care continues to gain traction. If it can deliver both better outcomes and lower costs, it could be a win-win for patients and the healthcare system as a whole.
Absolutely. And it could potentially transform how we think about and deliver musculoskeletal care.
Well, this has been a fascinating deep dive into Vori Health. We've covered a lot of ground from their unique approach to virtual care and patient testimonials to the broader trends shaping the future of musculoskeletal care.
We've also highlighted some important questions that need to be addressed as this model evolves, and ultimately the decision of whether or not to try Vori Health is a personal one.
That's right. But hopefully this conversation has given you the information and insights you need to make an informed decision.
And we encourage you to continue exploring these topics and engaging in conversations about the future of healthcare.
It's an exciting time to be following these developments, and we'll be here to guide you through it all.
So stay tuned for more deep dives into cutting-edge healthcare technologies and companies.
Thanks for spending 10 minutes with us, and be sure to look for more 10-minute health tech podcasts. Bye.
It really feels like they're trying to shift the paradigm, doesn't it? Moving from reactive care to this model that emphasizes prevention and long-term well-being.
Absolutely. And it makes you wonder, could this virtual first approach be applied to other areas of healthcare as well?
That's a fascinating thought. I mean, we're already seeing telehealth being used for things like primary care and mental health. Could this type of integrated whole-person approach be the next step?
I'm curious about the role of data in all this. Vori's digital care plan, it seems to rely pretty heavily on collecting and analyzing data from patients. What are your thoughts on that?
Yeah, that's an important point. On the one hand, data has the potential to really personalize care, track progress, and identify trends that might not be apparent otherwise. It could lead to more targeted interventions and better outcomes.
But on the other hand, there are concerns about privacy and data security.
Right, exactly. It's crucial that companies like Vori are transparent about how they collect, store, and use patient data.
Right.
And patients need to be informed about their rights and how to protect their privacy.
That's a good reminder for all of us. So we've talked about the potential benefits of Vori's approach. But what about the potential downsides? Are there any risks or challenges that we should be aware of?
Well, one potential challenge is the digital divide. Not everyone has access to reliable internet or the technology they need to participate in virtual care.
Right.
And this could exacerbate existing health disparities.
That's a critical point. It's important to ensure that virtual care solutions don't leave anyone behind.
Yeah, and there's the question of whether virtual care can truly replace the human touch of in-person interactions. While technology can facilitate communication, some patients might miss that face-to-face connection with their healthcare providers.
I can see that. There's something to be said for the empathy and reassurance that comes from a personal connection.
Right. And we can't forget about the importance of clinical judgment. Even with advanced technology, healthcare providers need to be able to assess patients holistically and make decisions based on their individual circumstances.
Right? Technology can be a powerful tool, But it's not a substitute for human expertise.
And ultimately, it's about finding the right balance between technology and human interaction to deliver the best possible care.
So as we wrap up our deep dive into Vori Health, what key takeaways do you think listeners should keep in mind?
Well, first, I think it's important to recognize that the landscape of musculoskeletal care is changing rapidly.
Yeah.
Technology is playing an increasingly prominent role, and new models of care are emerging.
And Vori Health is one example of this innovation. They're challenging the status quo by offering a virtual-first, whole-person approach to managing muscle and joint pain.
And while there are still many questions to be answered about the long-term effectiveness and cost-effectiveness of this model, it's certainly a promising development.
It's something to keep an eye on for sure. And as we've discussed, it's important to be informed about the potential benefits and drawbacks of any healthcare approach.
Exactly, and to make decisions that are right for your individual needs and circumstances.
So if you're dealing with muscle and joint pain, I encourage you to explore all of your options, including virtual care solutions like Vori Health.
And to stay informed about the latest advancements in musculoskeletal care.
It's fascinating to think about how technology is reshaping healthcare right before our eyes.
It really is, and it's not just about convenience, It's about empowering patients, improving outcomes, and potentially making healthcare more affordable.
Exactly. And it's exciting to see companies like Vori Health pushing the boundaries of what's possible.
Absolutely, and as we move forward, it'll be interesting to see how these innovations are integrated into the broader healthcare system.
That's a key point for virtual care to truly reach its potential. It needs to be more than just a standalone solution.
Right. It needs to be seamlessly integrated with other aspects of care, including primary care, specialist referrals, and even community resources.
And that requires collaboration and coordination across different stakeholders in the healthcare ecosystem.
It does, but the potential rewards are significant. If we can get it right, virtual care could revolutionize how we deliver and receive healthcare.
I'm curious about your thoughts on the future of musculoskeletal care specifically.
Yeah.
What trends do you see on the horizon?
Well, I think we'll continue to see a growing emphasis on personalized and preventative care.
Right.
Wearable technology, artificial intelligence, and data analytics will play a big role in tailoring treatments to individual needs and identifying risk factors early on.
That makes sense. And with an aging population, the demand for effective and accessible musculoskeletal care is only going to increase.
Exactly. So it's critical that we continue to innovate and invest in new solutions.
I'm also curious about the potential for virtual reality and augmented reality in musculoskeletal care.
Oh, yeah.
I've seen some interesting applications for physical therapy and pain management.
That's a really exciting area. VR and AR could create immersive and engaging experiences that enhance patient engagement and motivation.
And they could also provide new ways for healthcare providers to assess patients remotely and deliver personalized guidance.
Absolutely. The possibilities are vast, and I think we're just scratching the surface of what's possible.
Well, it seems like we've only just begun to explore the potential of technology to transform healthcare.
We have, and it's an exciting time to be involved in this field.
Absolutely. So for all of our listeners out there, I encourage you to stay curious, stay informed, and stay engaged in the conversation about the future of healthcare.
Because ultimately, it's about empowering ourselves to make the best decisions for our health and well-being.
Thanks for spending 10 minutes with us, and be sure to look for more 10-Minute Health Tech podcasts. Bye.